Now, many of you will have seen the warnings from our senior doctors about the huge impact that coronavirus is now having on the whole of our health service. The situation we are facing is extremely serious. And I have to tell you today that the Welsh Government has made the decision that we must move to alert level 4 and tighten the restrictions to control the spread of coronavirus and save lives. This new set of higher level restrictions will apply to the whole of Wales. And I am making this announcement today to give everybody the most notice we can of the changes that will follow. All of this means that all non-essential retail, including close contact services and all leisure and fitness centres, will close at the end of trading on Christmas Eve. All hospitality premises will close from 6 p.m. on Christmas Day. And on December the 28th, at the end of the 5-day Christmas period, tighter restrictions for household mixing, staying at home, holiday accommodation and travel will come into force. Now, I understand the impact that this will have on the lives of individuals and of our businesses here in Wales. We have made £340 million available to support businesses affected by restrictions into the new year. Further support will now be made available for those businesses affected by these new restrictions, and we will make further details of that additional support available by the end of this week. This has been such a long and difficult year, but that cannot lift the responsibility from us to act now, given the circumstances we face. This action is necessary to save lives, to support the health service, and to control the spread of this awful disease. Of course, we're not alone in facing these difficulties here in Wales. Across the world, coronavirus is accelerating once again. More than 300,000 people have now lost their lives in the United States. Here in Europe, Germany, the Netherlands and the Czech Republic have introduced new lockdowns this week. We too will take further action in the run-up to Christmas in order to help control the spread of coronavirus. Everyone who can work from home should now do so. Working from home is one of the most important contributions we can make in our own daily lives to dealing with COVID-19. Local authorities will now take decisions about the range of services they provide, such as libraries, leisure centres and recycling centres, ahead of Christmas. Today is the last day of school for the majority of children in Wales. Most schools are taking the last 2 days of term as inset days. And we will work with local authorities and the police to strengthen the enforcement of the coronavirus regulations and the guidance we provide to make sure all the measures to help keep us safe are in place and are being fully and properly observed. Yesterday I met with the First Ministers of Scotland and Northern Ireland and with Michael Gove from the UK Government to discuss common arrangements for the 5-day Christmas period. We have had a further meeting this morning. In the few short weeks since we made the original decision, the situation has changed considerably as coronavirus has gripped the UK once again. Later today, we will publish further joint advice across the United Kingdom, explaining that a smaller Christmas is a safer Christmas, that a shorter Christmas is a safer Christmas, and that here in Wales in particular, the advice of the Welsh Government is that only two households should come together to form an exclusive Christmas bubble during the 5-day period. The fewer people we mix with in our own homes, the less chance we have of catching or spreading the virus. Nobody wants to be ill at Christmas, and none of us want to give this deadly disease to our closest family or friends. Now, the Chief Medical Officer for Wales has already provided special advice for those people who were previously shielding about mixing over Christmas. This is available already on our website and in the joint advice that we will publish this afternoon. This message to those most vulnerable people in our community will be reinforced across the United Kingdom and here in Wales. The alert level 4 restrictions for household mixing, staying at home, holiday accommodation and travel will, as I said, come into force after the 5-day Christmas period on the 28th of December. This year has been unlike any we have known, and the weeks ahead will be very difficult. But the new year does bring with it some promise, as more and more people receive the COVID-19 vaccine and we use new testing technologies. Today, we start vaccinating people living in care homes, and we will continue vaccinating the priority groups during the alert level 4 period. Vaccination will continue throughout that time. And in January, we will start using the new rapid result tests to help people stay in work. Serial testing will be used in schools as an alternative to self-isolation for teachers and students, and that is being extended to the police and will be used to support care home staff to enable them to stay in work. In the meantime, it is all those small things that each one of us can do in our own lives that provides the greatest protection to ourselves, to our families, and by doing all of that, to keeping the whole of Wales safe. Diolch o galon fel arfer I chi gyd. I will now take some questions, and as usual, all the answers are broadcast live on our own social media channels. First, today is to go to Owain Clark at BBC Wales.
Diolch yn fawr, Prif Weinidog, ac os gallwn ni gael yr atebion i'r ddau gwestiwn nesaf yn Gymraeg hefyd, os gwelwch yn dda. Talking about the Christmas period in particular, what is your modelling telling you about what impact preventing people from going out shopping on Boxing Day and beyond will have on rates of infection, compared to what impact not allowing households to mix could have had if you had chosen to do that? Some might argue you are tinkering around the edges and not addressing the key threat over the Christmas period.
Diolch, Owain. Well, I don't think I could have been clearer, and the advice that we will provide across the United Kingdom, I think, will be very clear as well, that the modest amounts of additional freedom available to people over the Christmas period must be used carefully, responsibly and cautiously. And provided that happens, then people will still be able to enjoy Christmas without the dangers becoming such that it would be disproportionate to the freedoms that are being allowed. There's more than one form of harm from coronavirus, and to prevent people from meeting at all over the Christmas period would bring a different sort of harms with it. I explained on the floor of the Senedd yesterday the messages that I have been receiving, and they're deeply affecting messages from people explaining the impact that there would be on them if we were to prevent people from having any form of Christmas at all. The modelling does demonstrate that if we were to have a position in which large numbers of people would come together for Boxing Day sales, then that's another form of mixing. And whenever people get together, the risk of coronavirus rises. We are not in a position in Wales today where we could knowingly allow those risks to take place. Such is the seriousness of our position that we will have to act to minimise those risks wherever we can. We will do that over the Christmas period through the joint advice that we will publish today, and then we will take the actions that I have set out. So, y cyngor ni wedi roi dros y Deyrnas Unedig I gyd heddi yn glir. Ni gyd yn gallu wneud pethau I defnyddio'r ryddid sydd da ni dros y Nadolig mewn ffordd sy'n ofalus, sydd ddim yn creu fwy o problemau I bobl sy'n agos ato ni. Mae mwy nag un ffom o niwed sy'n dod o coronavirus. Ac I ddweud I bobl, does dim cyfle o gwbl I chi I dathlu Nadolig dy gilydd, bydd hwnna'n cael effaith ar bobl mewn ffyrdd eraill yn y maes iechyd meddwl ac yn y blaen. Ni'n wedi wneud y penderfyniadau dwi wedi cyhoeddi prynhawn yma, achos mae'r sefyllfa ni'n wynebu yma yng Nghymru yn mor ddifrifol. Dydyn ni ddim yn gallu osgoi wneud pethau sy'n helpu ni I tynnu nôl y nifer o bobl sy'n dioddau o coronavirus ac bobl sy'n dioddau mewn ffordd ble mae rhaid iddyn nhw cael triniaeth yn ein ysbytau. Dyna pam ni'n ddweud bydd dim cyfle I bobl mynd mas I siopa ar ôl a Nadolig. Mae hwnna yn mynd I helpu. Dyna beth mae'r modelau sydd da ni yn dangos a dyna pam ni wedi wneud y penderfyniadau.
Diolch yn fawr, Prif Weinidog. The advice, as you stated, was that no more than 2 households should mix during this period, but can you confirm the rules still allow for 3? Are you just passing the buck on to people for that? And what is your message to the NHS staff, which you mentioned in your opening statement, that have essentially been pleading with you in recent days to tighten up the restrictions or not to loosen them over Christmas? Beth yw'ch neges chi i'r staff y gwasanaeth iechyd?
Well, my message to staff in the National Health Service is that we have listened very carefully to what they have said, and it is why I have made this announcement today, partly to demonstrate to them that we are determined to do everything that we practically can to make sure that coronavirus, that the rising tide of it is held back, reduced, and the impact on our National Health Service is addressed in that way. If we were not listening to them, if we were not understanding the messages they are providing to us, I wouldn't be standing here making what will be for many people a very difficult announcement about the conditions we will all face in that immediate post-Christmas period. During the firebreak period, we saw an impact on hospital admissions within 10 days of us taking those actions. That means we can have some realistic expectation that with what we have done already, the restrictions in hospitality, the restrictions in schools, the closure of attractions, that we will see the impact of those further measures immediately after Christmas feeding into reduced pressure on the health service in January, when otherwise those pressures would be at their most intense. So it is exactly because of listening to what we have been told that we have drawn forward these announcements, drawn forward these restrictions because of our concern for the health service. On household mixing, the position in Wales is clear. I'm afraid people will have to wait for the statement that you will see this afternoon. The position in Wales is so serious that over the Christmas period, only 2 households should get together, and we will continue to allow one single person household to join in that arrangement over the 5-day period. Wel, y neges sydd â fi i'r bobl sy'n gweithio yn gwasanaethau iechyd yw ni wedi gwrando. Ni wedi gwrando ar beth mae pobl yn ddweud, ni wedi deall beth mae pobl yn ddweud, a dyna pam dwi wedi ddweud beth dwi wedi ddweud prynhawn yma. Dyna pam ni wedi tynnu y negeseuon i heddi, dyna pam ni wedi tynnu pethau ni'n mynd i wneud nhw syth ar ôl y Nadolig. A trwy wneud hynny, a gyda popeth ni wedi wneud yn barod yn y maes lletygarwch ac yn y maes ein ysgolion, ni'n gallu cael hyder bydd yr effaith ar y gwasanaeth iechyd yn mynd i cael ei weld yn ystod y mis Ionawr. A mae hwnna'n pwysig achos mae lot o'r pethau eraill sy'n wynebu yn gwasanaethau iechyd yn mis Ionawr bob blwyddyn. Dyna pam ni wedi wneud beth ni wedi wneud ar ôl clywed beth mae pobl sy'n gweithio ar engflaen yn ddweud i ni yma. A dyna pam dwi wedi bod yn glir am y neges i bobl dros y cyfnod Nadolig, dim ond 2 aelwyd sydd i ddod dy gilydd yma yng Nghymru. Mae'r sefyllfa mor ddifrifol. Dyna'r neges glir oddi wrth ni fel Llywodraeth, a bydd rhaid i pobl aros tan yn y prynhawn yma nawr i weld hwnna yn cyd-destun a gyngor ni'n mynd i cryfhau dros y Deyrnas Unedig i gyd. Owain, diolch yn fawr. Thank you very much. Over to Adrian Masters at ITV Wales.
Thank you, First Minister. I wonder, could you be absolutely explicit about the Christmas household doubling arrangements? Because I'm not sure that you have made it absolutely clear that your advice or the regulation has changed. It's no longer 3 households that are allowed, it's 2 households, and that is a break with the Four Nation Agreement. So perhaps you could explain why that's happened as well.
I think I've been as clear as I'm able to be at this point, Adrian. The result of the meetings between the 4 nations has not yet been published. I cannot anticipate that statement. That would be unfair to all the other governments of the United Kingdom. So let me be. I don't think the top message is as clear as it can be. Here in Wales, over the Christmas period, the clear message from the Welsh Government is that only 2 households should meet. That is how serious things are in Wales. Whether that's guidance, whether that's regulation, the message is the same. The message is identical in either case. Only 2 households should get together. That's how serious things are. I can't go beyond that until the results of the discussions between the 4 governments are published later today.
Thank you. And on the introduction of level 4 restrictions on Christmas Day at 6 o'clock, if the advice is that the situation is so serious in Wales that it requires that, why not introduce that now? Why wait till Christmas Day or Christmas evening?
Well, you will remember, Adrian, all the difficulties that were faced by the hospitality industry when we made the last set of changes. We are anxious to not to face that industry with additional difficulties at this point. And we are very alert to the fact, as I've said a number of times already today, there's more than one form of harm from coronavirus. We know that many people who live alone arrange their Christmas by booking a meal on Christmas Day so that they can be in the company of other people. I wanted to be able to honour that so that those people do not face an even bleaker Christmas, even more alone than they otherwise would be, with all the other harms that come from that. Everything we do is a balance between one form of harm and another. Allowing hospitality to continue to 6 p.m. on Christmas Day protects the plans that people have made, particularly those who are lonely and isolated, and allows the industry itself to come to an orderly close. Adrian, thank you. Over to Thomas Evans at S4C.
Pnawn da i chi, Brif Weinidog, diolch. Rhwng y 30 nawfed o Ragfyr, oedd y 7 awdurdod lleol ar draws y Deyrnas Unedig a oedd ar gyfradd uchaf o Covid-19 yn Ne Cymru. Felly, pam bod y cyfyngiadau yma lefel 4 yn mynd i fod ar draws Cymru gyfan ac ar pa bwynt ydych chi am amrywio hynny fesul ardal?
Thomas, diolch yn fawr. Wel, y gyngor ni wedi gael oddi wrth y prif swyddog meddygol a pobl eraill yw i cael un set o reoliadau sy'n mynd ar draws Cymru i gyd, mae hwnna'n fwy effeithiol. Ni wedi weld yn Llundain yn ydyn ni dros yr wythnos diwetha. Oedd Llundain dan cyfyngiadau lefel 2 yn Loegr, a mae hwnna ddim wedi gweithio. So, i cael pob un ohono ni dan yr un set o mesurau, mae hwnna'n mynd i warchod nid jyst bobl yn y dde, ond mae'n mynd i warchod bobl yn gogledd Cymru hefyd ac yn y gorllewin hefyd. So fel wedais i, ni'n mynd i ailedrych ar y cyfyngiadau ar ôl tair wythnos. Os mae patrymau wedi digwydd, ble ni'n gallu weld yn glir ac yn gynaladwy, mae wahaniaeth rhwng un lle yng Nghymru a'r ardaloedd eraill, allwn ni feddwl os bydd hwnna'n y foment i wneud pethau yn ranbarthol. A bydd yn dibynnu ar y sefyllfa ni'n wynebu ar ôl y tair wythnos. So Thomas was asking me why the level 4 restriction should be agreed across the whole of Wales, because levels of the coronavirus differ in parts of Wales, and I simply explained that the advice that we have had is that a simple set of national measures would be the most effective way of driving down the virus. We will review the regulations after 3 weeks. If some parts of Wales have established themselves as being in a different position, in a reliable and sustainable way, then that is the moment when we will see whether it would be sensible to introduce some regional differentiation. But we won't know that until that time, and those changes would need to be exactly that, sustained and reliable. Thomas, diolch.
Diolch am hynny. Dwi'n siŵr nad oeddech chi am gyflwyno'r mesurau lefel 4 yma yng Nghymru, ond ydych chi'n barod nawr i gyfaddef nad oedd y cyfnod clwbr yna, y toriad tân os oeddech chi wedi gweithio i'r lefel hoffech chi bod wedi gweithio?
Wel na, oedd y toriad tân, fel dwi wedi esbonio, oedd y toriad tân yn gweithio. Oedd y toriad tân yn gwneud popeth oeddwn ni'n disgwyl y toriad tân i wneud. Y problemau ni'n wynebu yw beth sydd wedi digwydd ar ôl y toriad tân. A mae'r nifer o bobl sy'n dioddau o coronavirus wedi cynyddu yn gyflymach nag oeddwn ni'n disgwyl, nag oedd y modelau yn disgwyl hefyd. Oeddwn ni'n gwybod oedd y cyfnod clo na yn effeithiol, yn tynnu y nifer o bobl sy'n dioddau o coronavirus i lawr, i tynnu'r lefel R i lawr. Dyna pam mae rhaid i ni ail-wneud hwnna syth ar ôl y Nadolig. Thomas was asking whether the need to go to level 4 restrictions suggested that the fire break period we had in October and the start of November had not succeeded, and I explained that that period actually did deliver everything that we had expected of it. It reduced the number of people suffering from coronavirus, it reduced the positivity rate, it reduced the number of people flowing into hospitals. It delivered everything we'd hoped of it. The problem has been in the period afterwards, in which coronavirus has circulated again faster than we or the models that we have available to us had predicted, and that's why we have to return to this most serious level of restrictions immediately after Christmas. Thomas, diolch yn fawr. Draw I Adam Hale, y PA.
In your mind, do the number of emails you yesterday, speaking of people's heart-rending pleas not to reverse the agreement, carry equal weight to the pleas from those working in strained hospitals across the country and the apparent majority of people across the UK who would be fine with measures
Well, they all weigh with me. Of course they do. And as I've said, this is a terrifically difficult balancing act, dealing with all four harms that come from coronavirus. At the very top of my mind has to be the advice we have from our National Health Service about the pressures that it is under, the number of staff in our health and social care system who are unable to be in work themselves because of coronavirus. That has to be at the very top of my list of considerations. But I cannot simply set aside what I hear from people about the impact of cancelling Christmas would have in their lives, because those mental health harms are equally real for those people. And that's why we can never have a simple, all the advantages lie in one direction, all the disadvantages lie in another. Whatever course of action you take, you are carefully having to balance the risks, the harms, and the positive outcomes that you are trying to achieve from them. And the people who write to me, whether they are people in the health service or whether they are people who are facing a very bleak and difficult period after a very bleak and difficult year, well, of course, all of those things have to be weighed up.
Diolch. Has our Welsh NHS the capacity to deal with the inevitable effects, and it is inevitable, isn't it, of rising cases and hospital admissions over Christmas because of these relaxed restrictions that you're sticking with?
Yes, the Welsh NHS is coping now with coronavirus. What I remember saying on Friday was this, that the risk we run is not that the NHS cannot cope with coronavirus, but that in coping with coronavirus, it ceases to be a national health service and becomes a national coronavirus service, only able to deal with that demand. And we know that that is not what people who work in the health service, the Welsh Government, or the people who use the health service would expect. Every day, our health service deals with people who are suffering from serious illnesses, heart conditions, strokes, cancer, services. What we are trying to do here is to reduce the impact of coronavirus in order to sustain all those other things that the health service has to do. If we were in a position where coronavirus continued to rise unabated, then in the middle of January, we could see nearly half the beds in the Welsh Health Service occupied by people who are so ill with this dreadful disease that they have to be in a hospital bed in order to get the care that they need. That is half the beds not available for everything else that the health service needs to do. So it's not that it can't cope with coronavirus. The health service will do that, but it's the impact that that has on everything else that we need the health service to do. That's what we're trying to safeguard. And the way to do that is to get on top of this virus by all the actions that we are taking and that we need people in their own lives to take. That will reduce the impact of the virus on the health service. That will allow the health service to be there when we need it for everything else that we rightly look to it to provide. Adam, diolch. Over to Will Hayward at Wales Online.
First Minister, people desperate to keep to the spirit as well as the letter of the advice will be keen for some clarification regarding the only two households coming together in Wales. So can I just ask, does two households mean two support bubbles? What happens to single-person households? How does the advice work for children with divorced parents? Can they travel between the two? And does that two-household advice for people apply to people travelling across the border? And finally, if I may, does the compassionate rule still apply that we've seen previously?
Right. Well, I'll try and remember those. You'll remind me if I don't, because I thought you made a very important point at the beginning, which is that the vast majority of people in Wales don't make a distinction between guidance and regulations and so on. They just want to know what is the right thing to do. And the right thing to do in Wales this Christmas is to stick to two households mixing. That's not two sets of two households. That is two households. So we've for a while now in Wales had an extended household made up of 2 households. People should stick to that. We will allow a single household that is not currently part of that extended household to join with that extended household over the 5 days of Christmas. That is still something that we would allow. Children of parents who are separated will be able to travel between them during the Christmas period, as we had previously indicated. And people who move across borders have to observe the rules that exist in the part of the United Kingdom that they are visiting. So rules in Scotland are already different in this regard, and it's the rules of the place that you are in that you have to observe. So people leaving Wales to go elsewhere must be careful to know the rules in whichever part of the United Kingdom they are visiting and to observe them. Did I miss any?
The compassionate rule, if I may?
Well, the compassionate rule, I think, is captured quite a lot by the ability of a single household now to join with a 2-household extended household. So the need for that compassionate rule is, I think, has been tackled in a different way.
Thank you. And so by way of clarification, a single person could join with another household, and they, as one bubble, could join with one other household.
Yes.
Fair to say.
Yes.
And so I want to ask about the impact of the restrictions on hospitality, if I may. Should we have locked down 2 weeks ago instead of just closing hospitality in order to avoid these increased restrictions over Christmas?
Well, hindsight is a wonderful thing, and I have a feeling that I answered a question from you, Will, at the time of the decision on hospitality, which suggested that we were going too far in closing hospitality as we did then. And I answered many, many questions of that sort, not simply, of course, from you. We followed Tier 3 restrictions at that point, and Tier 3 restrictions, we looked at what happened in other parts of the United Kingdom. The model that we adopted, which has allowed hospitality to stay open until 6 p.m, to allow people to have a meal without alcohol, that's a very significant set of restrictions, far more restrictive than existed before. And the evidence from elsewhere in the United Kingdom is that that would be effective. We're still waiting to see the impact of that here in Wales. It's less than 2 weeks since that change was made. We're having to go beyond that now. I doubt very much that if we had announced the complete closure of hospitality when we did so 10 days ago, that would have been regarded by most people in Wales as a reasonable step in the circumstances as we knew them then. Things have deteriorated, and deteriorated quickly during the 2 weeks that have followed, hence the need to take even more stringent measures. Well, thank you to Dan Wilson at LBC.
One household that perhaps would have had plans for Christmas might now be stuck alone over the festive break. Scotland has decided that 3 households will be allowed on one night of that 5-day period, and for the rest of it, 2 households. Why not maybe adopt that approach?
I just think it's because the advice we have had from our behavioural scientists in particular is that simplicity of messaging really helps people to know what is being asked of them, and then to allow them to sign up to what is being required. So there are many variations that we could have thought of around this message. In the end, our decision has been simple is best. And that leads us to the position which we face in Wales, where numbers are significantly different to Scotland, much more serious than the position Scotland currently faces, to a position where our unambiguous message to people in Wales is, over those 5 days, 2 households should get together, with the additional single-person household being able to join them. And anything else, trying to say 2 households, but only so many people, 3 households can only meet on one night, another. I just think it dilutes our ability to get the core message over to people in Wales about the seriousness of the position we face. Clarity, simplicity leads to better results.
Thank you. And obviously, as you well know, you've stood at that podium a handful of times now since the firebreak lockdown was announced in October. Constant changes being announced, which the public might find slightly confusing. Are you worried that you may be losing trust amongst the public?
Well, I worry all the time about the need to take people with us on this difficult journey. It is part of the reason why we decided to move this announcement to today, to give people the maximum period we could to learn about what we are saying and why we are saying it. The choice is between trying to always keep the most freedom you can for people and then to have to change that reasonably regularly as the position changes, or to be blunter about that and to take measures that people don't regard as proportionate to the position as they see it. And we've obviously had that debate a number of times here in Wales when we decided to go into the firebreak, when we introduced changes to hospitality. My job is to go on explaining. My job is to go on providing people with the evidence, the unchallengeable evidence that we see today in our health service, with a number of people so ill that they have to be in hospital, with the numbers rising of those people who are so ill, even in hospital, that only a critical care bed is sufficient to meet their needs. That's the part I can play, is to go on providing that advice, providing that information, taking the actions we can take, and doing it to the maximum extent we can in a way that takes the people of Wales with us on this immensely difficult and challenging journey. Dan, thank you to Rupert Evelyn of ITN.
Thank you, First Minister. You said in response to a question from the Press Association just now that the health service in Wales was coping. Yesterday, we spent a shift with the Welsh Ambulance Service, which ended up with us at Bridgend Hospital. We saw 9 ambulances stacked up outside that hospital. It's not an uncommon sight. It would have been the Heath the day before. It could be the brand new Grange Hospital every single day. And I'd like to tell you what the clinical director for emergency care told us while we were there. He said the whole system, you could say it to the crisis point. You could argue it's beyond the crisis point. I mean, with the ambulances outside like this, there's a strong argument that we are beyond crisis point. This is not safe. It was an assessment that is bleak as anything I've heard in the last 11 months. How is the health service coping? Really?
Well, the health service is coping because it continues to see, to admit and to treat the people who come to its door. Is it able to do it in the way it would wish to do it? Well, those stories just demonstrate the level of pressure that the health service is facing today, and that is exactly why I am here making this difficult message to people in Wales ahead of the Christmas period, that we have to take even further action and more stringent measures to respond to exactly the position that you saw. If it were not for the seriousness of it, we would not be having to convey these difficult messages, take these difficult decisions, and restrict lives in Wales as they will be restricted increasingly over the days ahead, and then even more significantly in the weeks immediately after the Christmas period.
But First Minister, the Princess of Wales Hospital is full. You can't just empty it. They are stuck. They've got too many people coming at the front door. They can't get people out the back door, so to speak. And let me give you another example of what's going on down there. Swab results are causing a lot of problems. People are waiting not just 12 hours or 24 hours or 30 hours. In that hospital, they sometimes wait 40 hours for swab results. They wait so long that they have to re-swab people in the hope that they get a result back. What on earth is going on with your health service?
Well, Rupert, I don't think anybody listening would have any difficulty in answering your question. What is going on with the health service is the effect of the public health crisis that we face here in Wales. The number of people who are suffering from coronavirus and the speed of its circulation is leading to the stresses and strains that are absolutely known to the Welsh Government, are vividly portrayed in what you have said, are communicated to us by senior clinicians in the health service, and have led to the decision that I have announced today. If anybody was not convinced by what I have said about the need to take these actions and the responsibility that we all share in putting these things into practice in our own lives, then I hope that they've heard what you have said. Because unless we can convince people in Wales of the seriousness of the position we face, we won't do what the last person who asked me a question asked me, is we won't succeed in persuading people in Wales that the actions we are taking are justified and that the contribution that they have to make to everything that everybody else is doing has to be maximised in order to draw the heat out of the health service and to allow it to cope both with the coronavirus demands and with everything else that the Princess of Wales and every other hospital continues to try to do every day. Over to Andrew Forgrave at the Daily Post.
Good afternoon, First Minister. I think everybody understands the gravity of the situation, but it does appear that it's more serious in some areas than others. In several counties in North Wales, for example, Gwynedd and Anglesey, the infection levels are more than 10 times lower than they are in parts of the south. You have previously alluded to the possibility of regionalisation at some stage. So why can't this be implemented now at the outset?
Because that would not be in the interests of people in North Wales. As I said in an earlier question, we have seen in London where a lower level of restrictions failed to prevent the rise of the virus, and now greater restrictions have to be in place. I think that to offer a lower level of protection to North Wales families would not be consistent with the duty that I have as First Minister. It would be an easy thing to do because I hear the calls. Why are you expecting people in North Wales to do this? Well, the reason we are asking people in North Wales to do this is because this will protect people in North Wales from the impact that would otherwise be felt there. Coronavirus is rising in every part of Wales. It is rising in the Betsy Cadwaladr University Health Board area as well. By taking action on an all-Wales basis, we act to protect people in every part of Wales. And as I said earlier, if we reach a position where a stable pattern of differentiation has emerged, where it is clear that some parts of Wales are reliably in a different position, where numbers are falling, not growing, then the plan we published on Monday allows us to make regional decisions. We're certainly not at that position today. When we come to the 3-week review of the measures that will come in after Christmas, we will look at that, of course. But I will not be prepared to offer North Wales a second-class level of protection when I know that the measures we are taking will save people's lives in that part of Wales, and I want to do that every bit as much there as I would in any part of our nation.
Would you simply be extending the length of the lockdown in January? And how long would you expect this to last? Are we talking weeks or months?
By allowing any additional level of household mixing, we add to some harms and we mitigate others. We add to the harms that come from the numbers potentially rising. That is not inevitable. The freedoms are not an instruction. I am asking people again today, we will be asking across the 4 nations of people to use those freedoms responsibly, carefully, cautiously, and to minimise harm. But we mitigate harm as well. We mitigate the harm of loneliness, of isolation, of the impact that this awful virus has on people's mental health. That is the balance that we are striking over those few days, a few days that matter so much to so many people here in Wales as elsewhere. I can't offer you a prediction of how long this will last. It will last for 3 weeks in the first instance. I said earlier that there was a small grounds for optimism given what we saw in the fire break period, that we begin to see the impact on our health service within 10 days of measures being taken, and we've taken some measures already. So it isn't, we will need to track that carefully, see where it gets us, review it at the end of the 3 weeks, and then see whether it is possible to alleviate any of the measures on a regional or indeed a national basis. Andrew, thank you. Over to Rob Taylor at Wrexham.com.
Good afternoon. You've said further support will be available for businesses affected by the new restrictions, and details will come through this week. Can you give an overview of what that will look like, and will it reflect, say, earlier this year when full lockdown was in place, i.e. business rates grants, economic resilience fund? And will it also reflect that this time of year is often when businesses make more of their turnover?
Well, the fact that businesses can trade right up until Christmas is part of a recognition of that final point, Rob, that you made, and it's another balancing of harms, isn't it? There are health harms, there are economic harms. It's absolutely right, and the messages have been very clearly conveyed to us by the sectors that this is a very important trading time of the year for businesses in Wales. They will be able to trade right through that most important period. There will be many millions of pounds additionally provided in help to businesses as a result of the restrictions that will come into place immediately after Christmas, and we will announce the details of that before the end of this week. I am keen to make use of the routes we have already used to get that help to businesses in the way that you've described, because the more we can use established routes of getting help to businesses, the quicker that help arrives with them. And I was pleased to report in the Senedd yesterday that the help that we promised as a result of the restrictions on hospitality, that hundreds of businesses and millions of pounds are already being provided to those businesses where we've been able to use routes that we had already established.
Thank you. And there's been a small-scale vaccination rollout for frontline healthcare staff at Wrexham's Hospital. However, the Executive Director of Primary and Community Care at the North Wales Health Board said there was plans for further rollouts in North Wales. However, those plans are changing due to a limited supply of vaccine. What is the issue with the vaccine supply, and when will it be resolved?
Well, the vaccine is arriving in Wales. It's arriving according to the schedules that we agree with the UK government. I always wanted the health service to have the most ambitious plans for vaccination. And as the supply of vaccine steps up, and particularly as we continue to hope that regulatory approval is given to the Oxford vaccine, still potentially within this calendar year, we will be able to maximise the impact of vaccination in frontline staff. And Rob, as you will know, it is in North Wales today that we have the first vaccination of care home residents. We're already vaccinating care home staff, but we're starting the process of care home resident vaccination today in North Wales. Provided that all goes according to plan, we'll be spreading that rapidly to the rest of Wales as well. To Sam Coates at Sky next, please.
First Minister, are you in any way embarrassed by the handling of everything that's happened today? I just watched the Prime Minister at Prime Minister's Questions in Westminster announcing that the laws on Christmas won't change, but you've just changed the guidance in Wales, and Nicola Sturgeon has just said that there's no agreement on the guidance across
across the four nations of the United Kingdom. The impression is, from these calls, that one of disorganisation, of confusing bickering, and that's putting lives at risk. Why can't you get your collective acts together?
The meeting that I attended this morning certainly wasn't characterised by bickering. It was characterised by a very sober reflection on the level of challenge that we are facing across the United Kingdom. We will publish today a joint statement strengthening the advice that we give to people across the United Kingdom as we move into the Christmas period. We had a discussion about how quickly that could be supplied, and of course, the quicker it can be done, the better. But I made the point that it was more important to me to get that advice right than it was to get it rushed. That is not a sign of the system not working or of people not working together. It is simply a sign of the seriousness of the position we all face and our determination to get the advice to people right.
But First Minister, in the end, the Prime Minister is emphasising that there can be 3 households meeting over Christmas under the law, and you're emphasising that under the guidance it should only be 2. Do you not concede that is at the very least confusing?
Well, not if you live in Wales, it won't be confusing, because in Wales it is the Welsh Government that people have to look to for that advice. We have to recognise that the position is different in different parts of the United Kingdom, as it has been through the whole of the coronavirus experience. I want to be clear, and have been clear this morning with people in Wales, we face a particularly challenging moment. As we go into those 5 days of Christmas, the unambiguous position of the Welsh Government is 2 households only should get together. If you want to avoid the sorts of difficulties that Rupert Evelyn was setting out from the visit he had made to one of our hospitals, that is the contribution that you can make in Wales. That's the position that the Welsh Government is advocating this afternoon. Sam, thank you very much. To Iolo Jones at Golwg 360.
Yn da, fi Brydog. Tua cyfnod hyn fis diwetha, roedd mae gryn sylwi ym medawiad Dominic Cymru'n prif ymgynghorydd Boris Johnson ar y pryd. Mae yna gryn dyfalu wedi bod am oblygiadau hyn gyda rhain gweud bod 10 Downing Street yn le gwbl wahanol bellach. Yn hirw mae yna fwy o fyrodrwydd i gydweithio a chyfathrebu ag adrannau. Ydy Llywodraeth Cymru wedi profi newid agwedd gan Llywodraeth San Steffan? Ti'n gofyn hyn am eich bod wedi cwyno sawl gwaith am bamwylletwydd mae'r berthynas ar y degau o werthu gyfewn cyd-destun Covid-19?
Wel, dydy yn wedi weld newid dros y mis diwetha. Dwi ddim yn siŵr pam mae hwnna'n wedi digwydd. Dwi wedi trial i perswadio'r Llywodraeth y Daenus Unedig dros y cyfnod o coronavirus i gyd, jyst i roi fwy o cyfleon i ni dod dy gilydd mewn ffordd sy'n dibyniadwy. A dyma beth ni wedi ddweld dros y mis diwetha. Ni wedi cwrdd bob wythnos mwy nag unwaith am nifer o wythnosau. So dwi'n croesawu hwnna, mae'n help fel oeddwn ni'n disgwyl. Jyst i clywed beth sy'n mynd ymlaen mewn gwledydd eraill yn y Daenus Unedig, i rannu wybodaeth, i rannu beth sy'n mynd ymlaen da ni, a trwy hynny i wneud y penderfyniadau gorau ni gyd yn gallu wneud. So Iolo was asking me whether I had seen any change in the willingness of the UK government to operate on a full-nation basis in the period after the departure of Dominic Cummings. Well, I've no way of linking what has happened to any particular individual or event, but the facts are simply that over the last month, we have had a more regular and reliable pattern of engagement with the UK government, and I welcome that, because I've tried to make the case throughout coronavirus that regularity of engagement leads to better sharing of information, better understanding of different perspectives, and in the end, better decision making.
Wedyn o ran yr ail gwestiwn, mae yna dipyn o drafodaeth wedi bod yn yr Alban ynghylch darlledu cynadledau wasg yr SNP. Nath BBC yr Alban gytogi darllediadau ym mis Medi oherwydd pryderon am bias, yn dath probedol yn sgil hynny. Ac yn ddiweddar mae'r arglwydd George Folks, sy'n aelod o Blaid Lafur, wedi galw ar ei ofcom yn chwilio i'r darllediadau wrth i etholiadau etholiad Holyrood nesau. Beth ych chi'n meddwl o'r ddadl yma bod cenedlaethau Covid yn blatfform pleidiol yn ogystal â gwasanaeth y cyhoedd? Os angen i Llywodraeth Cymru fod yn ofalus o'r sesiynau yma wrth i etholiad y Senedd yn tai?
Wel, i gweud y gwir, dwi ddim yn gyfarwydd gyda'r ddadl sy'n mynd ymlaen ar Alban. Yma, dwi'n meddwl y ffordd mae'r Senedd yn gweithio yn deg i ni gyd, y mae'r llywydd yn ofalus dros ben i fod yn deg i bob blaid. Fel Llywodraeth, ni wedi rhoi cyfleon i'r arweinydd yr wrthblaid ac i'r arweinydd Plaid Cymru i dod i fewn, i cael sgwrs gyda'r swyddogion uwch ni, i clywed oddi wrth nhw am y sefyllfa ni'n wynebu, a dwi wedi trial bob tro ni'n wynebu penderfyniadau mawr i rannu beth sydd tu ôl y penderfyniadau na ac i roi rhyw fath o amser cyn ni'n neud nhw yn cyhoeddus i'r arweinydd y pleidiau eraill. Euro was asking me about a debate that's going on in Scotland as to whether coronavirus has provided an advantage to government in occupying public debate and opportunities in the Parliament. I'm not familiar with the debate, I'm afraid, in Scotland. Here in Wales, I think our presiding officer is scrupulous to make sure that all parties are treated fairly in the Senedd. And as a government, we have held weekly meetings with the leaders of both Plaid Cymru and of the Welsh Conservatives to offer them access to senior officials here so that they see the information that we have as a government. And when I face major decisions of the sort that we have announced today, I've always made it the practice to contact the leaders of the two other parties in advance to explain to them the background to the decision and to make sure that they hear it before it is publicly announced. And all of that is an effort to make sure that we address these matters in the fairest way that we can during this extraordinary period. Iolo, diolch yn fawr ac yn ola heddi last today to Tom Magna at Carers World.
Thank you very much indeed, First Minister. You've referred at various stages today to balances of harm. Against the background of the NHS experiences reported earlier by ITN, can I ask you to look specifically at the balance of healthcare harm, where doctors make life and death medical decisions, say, for example, to treat a COVID-19 patient, whatever their state of health, ahead of a seriously ill non-COVID-19 patient? Doesn't maintaining the Christmas relaxation, albeit modified, as well as the continuing effect of the pre-pandemic funding pressures on the NHS in Wales, tip the balance of healthcare harm, no matter what you may wish for, realistically towards treating only COVID-19 patients at the expense of treating seriously ill non-COVID-19 patients? Whether yes or no, I'd be interested in your reasoning.
Well, it is precisely in order to avoid getting to that position that we are making the decisions we have today. If we are not prepared to take the actions that are needed, and if we can't persuade people in Wales of the need to do so, then we will end up in the position that you have described. That is how serious things are. We have to balance even that against other harms, as well as the letters that I have read from people explaining just how important it will be for them, for their mental health, to be able to meet some other people over Christmas. I read letters from informal carers as well, telling me that their ability to go on providing the service that they do day in, day out depends upon them getting a little bit of extra help over Christmas from other members of their wider family. So these are all impossible balances to try to strike. It is why we continue to allow some modest additional freedoms over those 5 days, balanced against the actions we then need to take to prevent the health service having to make the sort of decisions, Tom, that you referred to.
You referred to unpaid carers. There, of course, the health and survival of two people stands to be at risk rather than just simply one. shouldn't that tip the balance of harm in those cases back towards treating seriously ill non-COVID patients in the home unpaid caring context in place of some COVID-19 patients? A difficult decision, but isn't that one that should be a factor?
Well, Tom, all I can say again is that our aim is not to have to make those choices. We're not making those choices in the NHS today. I said earlier on that we had 98 patients suffering from coronavirus in critical care. We have more than that number in critical care for other reasons. So we haven't reached the point, and I don't want us to reach the point where doctors are having to make those incredibly invidious decisions. Unless we take action, that is where we would end up. It's why we have made the decision, why we've made it public today, why we need to ask people in Wales to make this extraordinary effort, even at a time of year when in all other circumstances, people would be looking for greater freedom in their lives, rather than facing having to go into a period where things are going to be tougher still. Tougher for carers, tougher for people living on their own, tougher for businesses, tougher in our public services. None of those decisions can be made lightly, but they are being made expressly in order to prevent our health service having to choose between people who they can treat and people who they can't treat, both of whom have serious need to be there. Thank you all very much indeed. Diolch yn fawr.
Thank you very much, everyone.
Yes, thanks.
Thank you.
See you Friday.